the show. This is so exciting. We are launching a Golden Years series here on The Social. So throughout these segments, we are going to be diving into the concerns, the alternatives, and solutions facing Canada's aging population, which, by the way, is all of us. We'll be speaking with a range of fantastic experts on the ways that we can all and should collectively work towards a healthier and happier third act of our lives.
Yes, and to kick off the series, we're going to consider what needs to be done to catch up with Canada's growing senior population. We're thrilled to welcome Dr. Samir Sinha to the show, who is the Director of Geriatrics at Mount Sinai and the University Health Network Hospital in Toronto. Welcome to the show.
Welcome to the show.
Thank you so much for being here. So, Doctor, the Canada is on track to become a super aged country. Can you explain what that is and where Canada stands right now?
Yeah, so that's going to happen this year, where 1 in 5 Canadians is going to be an older Canadian. And soon, 1 in 4 of us is going to be what I like to say 65 and older, or 65 and better. So we need to remember that, in 1900, we had a life expectancy of 51 years of age.
Right.
When now, if you make it to 65, which most of us will, you have about 20 years of life expectancy ahead of you. And centenarians, people 100 years and older, fastest growing segment in Canadian population today.
What?
That's
Absolutely.
exciting.
Yeah.
What the hell?
As long as we can get the care that we need, which is a massive problem. And you say one of the main reasons that Canada isn't able to provide the necessary services for aging Canadians is because the system wasn't designed for them. So who did they design the system for?
Well, this is the challenge. We have a 21st century healthcare system that's running it with a 20th century model.
Yeah.
So when we created our national healthcare system back in the 60s, the average Canadian was 27 years of age. So we enshrined hospital services and physician services, but we designed a system for 27-year-olds, not 72-year-olds. So we need things like prescription drug coverage, dental care, long-term care services like home care. And when you put all of that together, we have a system that works for everybody.
That's incredible.
I mean, the backbone of our healthcare system, as we all learned during the height of the pandemic, is people. So let's talk about the crisis of caregiving for an aging population, because you say right now it is not sustainable as it is.
It isn't, because we think about physicians like myself as care providers, but we talk about unpaid caregivers. So about 8 million Canadians, about 1 in 4 of us, is actually providing unpaid caregiver as a spouse or partner, or as a family member and a friend in some way. And this is a really important segment of the population, because we're gonna face a challenge because we're having smaller families. Some of us are not having any children, and we know that in the next 20 years, there's gonna be 30% fewer family caregivers. So we need to make sure that we do what we can to make sure that those who want to provide and support their loved ones actually have the support they need to do so.
All right, so we've identified the problem. So what's a realistic solution to that?
Yeah, there's 3 things that we can do. Number 1 is we have to make sure that anybody who wants to provide unpaid care, and most people do, is that they have the knowledge and skills they need. So if you're caring for a loved one with dementia, you want to make sure you understand what the disease is, what you can expect, so you're better prepared. You also want to make sure that people have access to financial support. So with tax season around the corner, most caregivers don't know that they're available. They can apply for the Canada Caregiver Credit or other benefits that can actually allow them to get some financial supports. And finally, making sure that we have services so that we don't completely overload caregivers by having to provide all the care when they're currently providing 75% of the home care that Canadians currently receive.
Wow, that's staggering. That is staggering. I think most people would say that they would hope that they could age in place, that they could stay at their home. But the reality is that most people will end up, at least even for a time, either in a hospital or in a long-term care home. So you've actually been working to sort of re-engineer the care for the elderly in institutions. Can you talk about some of the examples of what that looks like?
Yeah, so we have to make sure that with an aging population, knowing that on any given day, 6 out of 10 people in a hospital is actually an older person, we need to make sure our hospitals are elder-friendly. And so what does that mean? When you have a system designed for 27-year-olds, we put you flat, we do lots of things to you, but we have to recognize that for older people, you've heard the term move it or lose it, right? For older people, bed rest is actually deadly. The more time you spend flat, you lose function. And we often say that every day that you're lying flat, you need 2 days to recover that. So we're trying to develop models to identify people who are at greater risk, but also making sure that we're promoting more mobility, keeping people upright, making sure that they're staying active throughout the hospitalization so they're more likely to be able to return home and back to being independent.
Oh,
wow.
Wow. Whoa. You're also, Doctor, the Director of Health Policy Research at the National Institute for Aging. So I want to talk about the redistribution of funding that goes towards Canada's aging population. Where do you think it should go?
Yeah, so again, when we think about our healthcare system, when it was designed for 27-year-olds and not for 72-year-olds, it's just about saying, what are we doing and how do we make sure that we're investing more in, say, home and community care services, things that actually help people stay in their own homes where they want to be, as opposed to having to live in hospitals or long-term care homes, which are more expensive. And countries like Denmark have really done a good job, and other European countries where they've really focused on providing more care and support so people can age well for longer in the community. And that's really what people want.
Just quickly, are there other places besides Denmark who are doing it well? Like,
yeah, so
that we can look to almost as a model?
I think a lot of European countries are really taking an approach where they're saying, look, we have an aging population. People want to stay in their own homes and communities as long as possible. So again, there's good examples around the world. We need to import them and spread them across
as
Canada.
soon as possible.
As soon as possible.
Yesterday.
Yesterday. It's true. This all sounds reasonable, but it also sounds very expensive. Can Canada afford to take care of what is coming, as you said, starting this year with an aging population?
We can't afford not to do this, right? And people say, well, this all sounds very expensive, and is this even sustainable? Well, actually, you know, if we actually take our current resources and reprioritize them the way we can not only keep our system sustainable, but we can allow more people to age in their own homes and communities for as long as possible. So this is not pie in the sky. Other countries are demonstrating this is how we need to do it, and we need to do it too.
All right, so when you look 20, 30 years down the line, what would you like to see for Canada's aging population?
Well, it's not the aging population, it's all of us, right?
Yeah.
We all want to stay healthy and independent in our homes for as long as possible. It's what every one of my patients say. So we all want to achieve that. So it's making sure that people know the things they can do to live healthy and active lives. What can we do to make sure people can get the right forms of care they need? But it's also a lot of the focus we do at the NIA is focusing on financial security, making sure that people can afford to age well and actually have those choices to get the right care they need, but to also live healthy and active lives.
So many good
Doctor, what a mind-blowing conversation. Thank you so much for joining us today. I hope you'll come back and keep us informed
Would love to.
about where we are. Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.